scientific session this morning to address the quality of life. Our first presenter will be Mariette Zur from Netherlands, and she will address the assessment of pain, quality of life, and self-perception of trunk appearance in patients with idiopathic scoliosis in respect of the rigo classification, a preliminary study.
Gentlemen, I'm Mariette Zur from the Netherlands. I'm a BSPTS therapist and co-owner of Scoliosiscareclinic. It's a great honor to present you our study, the assessment of pain, of quality of life and self-perception of trunk appearance in patients with idiopathic scoliosis in respect of the rigo classification, and it's a preliminary study. We have nothing to disclose. The aim of the study was assessment of quality of life, occurrence of pain, self-perception of trunk appearance in patients diagnosed with idiopathic scoliosis in respect of the rigo classification, and an additional goal was to determine the type of the scoliosis in which pain occurs the most often. Our study group was formed by 71 women. They were aged from 12 to 39 years. And they were all diagnosed with idiopathic scoliosis, and they were treated at Scoliosiscareclinic in the Netherlands. All patients with idiopathic scoliosis were divided into 4 comparable subgroups by type of scoliosis according to the rigo classification. The table shows you the number of the subjects, the age of onset of scoliosis, the age of the women, and the cup angle and primary curve measured by X-ray. To our research, we included women diagnosed with idiopathic scoliosis, used BSPTS short method for treatment, and who did not follow other treatment before, like PSSE, brace or surgery. For assessment of the value of the cup angle and classification to the rigo system, we used X-rays. Quality of life and minimum and maximum range of pain were evaluated by using questionnaires. We did assessment with SOS 22 and the FAST scale. For patients' perception of the trunk deformity, we used the TAPS. To determine the value of the virtual scoliosis angle, rotation, kyphosis and lordosis, we used the full metric. All parameters were used during the first consultation. There were no difference between groups in value of the primary cup angle measuring X-ray images. The results of the SRS 22, we see quite similar scores in every domain. The lowest score we see on self-image, and the highest score we see on function. The SRS also showed a very good total score, but no statistical significance in any group and domain. Here you see the average value of the minimum and maximum score of the FAST scale in each group, and this means no statistical significance in results of the FAST scale in any group. This table shows the difference between the groups in average value of the total score of the TAPS. The results of the groups are quite similar. This means we see no statistical significance in the results of the TAPS scale in any group. And in this slide you see the results of the volumetric parameters. We did measure in virtual scoliosis angle, rotation, kyphosis and lordosis. The greater value of the virtual scoliosis angle obtained in group 1, the 3C type of scoliosis. In the case of the scoliosis type E, group 4, we obtained the smallest virtual scoliosis angle, the greater magnitude of the kyphosis and the smallest value of the surface rotation. And here we see the average value of the cup angle and primary curve and the correlation between SRS 22, FAST minimum, FAST maximum and the TAPS. There is no correlation between the SRS 22, the FAST scale or the volumetric parameters. Only the cup angle can influence on TAPS. Here you see the correlation between the TAPS score and the cup angle in primary curve. especially in Group 1, the 3C type, and Group 3, the non-3, non-4 type of scoliosis, using the classification, rigo classification. I would like to summarize the results. So our research shows, in comparison of the groups, no statistical significance difference in the value of the VAS. Furthermore, scoliosis type had no influence on the results of the SOSORT and no statistical significance association between the cup angle in the primary curve and the VAS scale. Our conclusion: the occurrence of pain, perception of deformation or quality of life are not related to the scoliosis type according to the rigo classification. Thank you very much for your attention.